With the inclusion of the elderly and those with comorbidities, how will mass inoculation fare as we enter the second quarter? To discuss government's game plan, we have on the line Maria Consorcia Lim-Quizon of the National Immunization Technical Advisory Group. Dr. Kongki, welcome to the big story.
Thank you, and good evening to you, Robbie and Gretchen.
Ma'am, before anything else, we are now entering ECQ. How do you feel about this lockdown?
The ECQ and the lockdown will definitely help us de-escalate the problem. You know, as you've noticed in the past 2 weeks, the climb of the number of cases is rather steep. And the thing here is, well, they're saying 95% is mild. But remember that 5% would therefore be either moderate or severe. And that is what we are trying to control, is that we overwhelm our hospital system. So that with the ECQ and the lockdown, we can imagine that we will be able to de-escalate or slow down the number of cases.
Okay, now we did start with a vaccination program targeting, of course, the frontliners. Now we're getting the go signal to have the elderly and those with comorbidities to get their inoculation. What's there to consider? What changes, if anything, in the vaccination program and the protocols for these particular sectors?
Well, there was no change in the first place because they were really second or third in line, right? And then considering, and you know this, that the most vulnerable or the risk of dying are the senior citizen and those with comorbidities. And that is exactly what we're trying to prevent. So it's just very timely that this next tranche of vaccine came, and that they are really in priority and next in priority. So we have high hopes.
Okay, now in the meantime, it's still only just a little over half of healthcare workers that have been inoculated 1 month into the program. Where is the bottleneck, the hesitancy? Where are the problems in the rollout?
The hesitancy is actually in some health workers still trying to wait for a better vaccine, although we keep on saying the best vaccine is the one in your arms. So, however, the good news is that that has not gone to waste, because, you know, even among healthcare workers, there is a list of priorities and so on down the line. So for those, let's say, for example, a hospital haven't yet inoculated 100% of its staff, then, you know, they went to the next in line and next in line. You know, there are some LGUs that were able to vaccinate down to the births level. So that is extremely useful, especially for NCR.
Okay, Dr. Lim-Quizon, maraming salamat po.